All right, so you have gone through the movement flows, you know a ton of exercises and positions that are going to help your pelvis move through labor. And you have been practicing those daily because that's going to help everything be more mobile so you can get into the positions you need to for labor. But now you're in labor, and what the heck do you do? So initially, early on, we're going to want to do all of our pelvic inlet positions to really help baby engage down into that pelvis. So thinking of some shallow squats, so not lower than 90 degrees, will help open the pelvic inlet. Also, any positions with knees wider than feet. So if you think about our rock backs on the ball, or even just without the ball, rocking back here is going to help encourage your pelvic inlet to open. Also, during this time, you just want to allow your body to rest. You are gearing up for the more active phase of labor and then pushing in delivery. So, yes, you can do some exercises if they feel good, but don't stress it. You have put in the work. Baby is starting to engage. Obviously, if you're having a lot of early labor, get a little bit of movement in, but don't think that now that you've started contractions that you can't rest. It's really important to rest, hydrate, and nourish your body. Moving into active labor, we are going to work on that asymmetrical movement of the pelvis. So, thinking of things like our lunge position here. And if you are at a hospital or a birth center, most of them have a birth ball or a peanut ball, which we will get into, that you can utilize during labor. So a lot of that asymmetrical movement, so that lunge position, walking sideways up and down the stairs, just like how we were doing kind of those lunges onto the block. You can do lunges onto the stair, or bring a yoga block in your hospital bag so you have something to make your hips uneven. Curb walking can be great if you are delivering at home or at a birth center that has a good area to walk around outside. But this is that time that you really want to work on those asymmetrical pelvic movements. Finally, during pushing, we are going to work in positions that open up that pelvic outlet. So this will look like putting your knees together with your feet wide and moving into some of these positions that open up your pelvic outlet. Getting into a deep squat can also be helpful in opening your pelvic outlet. And if you are having trouble, you can always tie a long bed sheet above with a big knot in it, hook it above the door, shut the door, slam it tight, make sure it's not coming down, and then using that to kind of support yourself in that deep squat. A lot of times you can also use a partner for support or a doula for support in that deep squat position, but it's really good to open up that pelvic outlet as you get into that transition and pushing phase.